Friends, I hope 80% of the crowd is here is Presbeyond. And I would just ask my friends, like if they can raise their hand, those who want to lose their presbyopic correction. No, whatsoever is there, like those who are presbyope and don't want presbyope. So, of course, like presbyopia, rather than say, it's a huge upcoming subject because you'll find a lot of patients they need, and they really after 42, 45 years, many of them, they definitely come to you and ask you, say, can it be done for me? Say, many of them, like if you make in your consulting room, the posters are available that after 40 years, you can lose your classes, ask us. So many of them, they are really curious after the age of almost 45 years. We have got a small study, what we have done on corneal inlays. So corneal inlays is a very interesting subject because one thing is it can be reversible, and what you are interested, like it can be retouched after some years. If you want to change your correction, you can change the inlay. That's very simple. We don't have any financial interest into that. As you must have seen that almost 80% of our friends, they have raised their hands for their presbyopia reversal. And there are different techniques like available right now. There are more than almost 1.5 dozen procedures available for presbyopia reversal. So some of them are scleral. One of our friends has put down. More people are in favor of corneal. And of course, like some of them are now interested after the age of 45 or 50, whether you want to still go ahead for corneal or then lens-based. So many lens-based procedures also are coming up. And of course, many of them surgeries because of the rather than like the fineness, the expertise available here, you find the presbyopic surgeries are becoming safer and safer. So many people, they opt for that, and many surgeons, they are coming up for adding these procedures to that. So in Palikari's presbyopia surgery algorithm, so what he prefers is between 40 to 45 years, the monovision correction is preferred, the multifocal laser as this thing, and conductive keratoplasty at that time for hyperopia and intracorneal. What is more important age group we are interested is 45 to 55. So for that, like for myopes and hyperopes, you will find between 45 to 55, the monovision, multifocal laser, and conductive keratoplasty for hyperopia are the preferred procedures. And above 55, usually you find for E-metrope, you don't touch those patients, those who are above 55. But for other things like after 55, you can choose clear lens extraction with accommodative or multifocal IR. How to manage an plano-presbyopic patient between 45 to 55-year-old? Of course, the corneal laser, like LASIK myopic monovision, 2 old clear lens extension, because he is too young for that. But we need a method for this target group, which is minimal invasive and reversible too. So intracorneal implants. The corneal inlay, the intracorneal lenses are very thin, almost like 20 micron to 30 micron in thickness. implanted in mid-stroma of non-dominant eye. It improves the uncorrected visual acuity for near distance by modifying monovision approach. There are different intracorneal inlays available right now or being tried. What we have tried is Flexivue, Presbeyond micro lens. Camera is, of course, one of the popular lens, and the Presbeyond lens by Revision. So in Flexivue, the design is such that the center of the inlay is without refractive power. And the periphery one is, it works for near vision, and it's from plus 1.25 to plus 3 diopter. So it works like the central one works like a pinhole effect and gives better depth of focus. Of course, the thickness is 20 micron, and you'll find the central one works for far vision. The major myopia effect in pupils with 3 to 5 millimeter diameter. The effect decreased in far vision where the pupil was increased in diameter more than 5 to 6 millimeter. This is a concept of smart monovision. The implantation is done so previously with keratome, and now the femtosecond Inlays 150 to form a pocket, and this pocket is formed say around 5.5 millimeter to 6 millimeter, and you are seeing the inlays put in. It is, the inlay is centered for pre-surgical position of the first Purkinje reflex, line of sight. The procedure is hardly done in 2 minutes. And what you see after the surgery is performed on second or third day on slit lamp examination, you find the corneal inlay appears like halo. And what we had done, 31 at the University of Crete, the study was performed with Professor Palikaris and Cuminis. 31 plano presbyopic patients were enrolled and underwent Flexivue corneal inlay implantation. 18 males, 13 females. Mean age was 47.2, 45 to 52 years of age. The minimum follow-up was 6 months, and mean depth of pocket was 285 micron. And you'll find the efficacy for near vision was almost like after 1 month, it was almost 63%, and after 3 months, it was almost 77%. 100% of the eyes have uncorrected visual acuity for near better than 20/40, or better 77% were 20/20 and 20/25 with excellent efficacy. This is uncorrected distance visual acuity in the operated eye. The mean pre-op was 20/20 and mean post-op was 20/40. So there was not much loss of distance vision also. And so this is something like you had not very much compromised distance vision and near vision as you do in monovision corneal surgeries. None of them lost more than 1 line of best corrected visual acuity for near as well as far vision after the procedure. The safety, of course, like what we need to look at when you are doing any intracorneal procedure is the confocal microscopy has proved that it is totally safe. The comparison of other inlays, and in conclusion, early study shows that corneal inlays demonstrated good efficacy of gain in unaided near vision with minimal compromise on unaided distant vision in plano presbyope. It's very good for people, those who are plano presbyope. This minimal invasive and reversible procedure demonstrated good safety and maintenance of the corneal structural health in our group of patients. New technology merits further long-term studies because you need to still go for say more years with these corneal inlays. But whatsoever we had done a small group study, we are happy, and for plano presbyope, we could find that this is excellent reversible procedure, and you can definitely choose then after 55 years any lenticular procedure, lens-based procedure as required or demanded. Thank you for your kind listening.